We invite you to participate in the STOP-PC clinical trial that will evaluate the effect of adding a novel drug candidate, OT-101, to mFOLFIRINOX on the treatment of advanced and unresectable or metastatic pancreatic cancer. At the time of diagnosis, the cancer has either spread or can't be surgically removed. Standard treatment includes chemotherapy and sometimes radiation. The first-line chemotherapy choices include gemcitabine, mFOLFIRINOX, or albumin-bound paclitaxel, nab-paclitaxel for short, with gemcitabine. If the cancer gets worse, patients who are deemed healthy enough to tolerate more chemotherapy receive second-line treatment. The transformation growth factor, beta, TGF-beta for short, is a protein that modulates the activity of immune cells. In cancer tissue, it suppresses immune cell response and contributes to tumor growth and spread. OT-101 is an investigational first-in-class RNA therapeutic designed to fight the immunosuppressive actions of TGF-beta2, reduce the level of TGF-beta2 in malignant tumors, and thereby delay the progression of disease. When OT-101 is added to human pancreatic cancer cell cultures, it shows significant suppression of cancer growth by making immune cells more active and by blocking cancer migration. In a mouse model of metastatic pancreatic cancer, OT-101 reduced tumor size and metastatic spread. OT-101 was studied in humans in a Phase 1-2 clinical trial. 61 patients with stage 3 and 4 advanced or metastatic solid tumors were treated with OT-101, including 37 patients with pancreatic cancer. 50 patients, 82%, completed the core study and received 2 cycles of OT-101. And 42 patients, including 25 pancreatic cancer patients, participated in extension cycles. 1 patient with metastatic pancreatic cancer had a complete response, and 14 patients, 38.9%, achieved stable disease. 8 patients with pancreatic cancer who received the OT-101 at a low dose of 140 milligrams per meter squared per day, with the 4 days on, 10 days off schedule, had the median overall survival of 442.5 days, or 14.5 months. OT-101 has demonstrated notable single-agent activity, consistently surpassing reported literature data for overall survival. Importantly, the overall survival increased in a dose-dependent manner at the levels of 140 milligrams per meter squared and higher. This clinical trial will evaluate the therapeutic potential of combining mFOLFIRINOX with OT-101 at the dose of 140 milligrams per meter squared and above. The most common adverse events during the study were nausea, fatigue, abdominal pain, and constipation. 23% discontinued treatment due to adverse events. The Phase 2-3 trial that you are being asked to participate in will compare OT-101 plus chemotherapy treatment called modified FOLFIRINOX, mFOLFIRINOX, with mFOLFIRINOX alone. The trial will have 2 parts. Part 1 of the trial is designed to confirm the safety and tolerability of OT-101 at the 140 to 250 milligram per meter squared per day dose given on a 4 days on, 10 days off schedule in combination with mFOLFIRINOX. The goal of Part 1 is to estimate the maximum tolerated dose of OT-101. After completion of Part 1, a justification for the dose regimen of OT-101 for Part 2 will be discussed with the FDA. Once the FDA determines Part 2 can proceed, patients will be randomized in a 1-to-1 ratio to OT-101 combined with mFOLFIRINOX or mFOLFIRINOX alone. The main goal of Part 2 is to compare the efficacy of OT-101 in combination with mFOLFIRINOX versus mFOLFIRINOX alone in patients with metastatic pancreatic cancer by measuring the overall survival. Patients who will be treated with OT-101 plus mFOLFIRINOX will receive up to 12 cycles of combination chemotherapy or, if experiencing intolerance to mFOLFIRINOX, may continue to receive maintenance OT-101. Patients may receive mFOLFIRINOX in both study arms for up to 12 cycles or 24 weeks and will be treated until tumor progression. Patient safety during the study will be monitored closely and continuously by a safety monitoring committee comprised of top experts in the field of pancreatic cancer. To join the study, patients must have advanced or metastatic pancreatic cancer, to be fit enough to receive chemotherapy, and have adequate laboratory parameters. Your doctor will explain if you're eligible. The decision to participate in this complex clinical trial must be carefully considered. Ask questions to understand all the details before deciding and remembering that your health comes first. Your medical team will guide you through the best choices for your situation. Thank you for your interest in the OT-101 clinical trial and for considering participation in this research program. For additional information about this clinical trial, please visit www.stop-pc.com.